stars and stripes. Dumpster fire vibe. Come on. All American why? All American why? All American why? Ask yourself the American why.
Hello, my excessive thinkers. Before we get into this episode, I need to admit something. When I started researching universal healthcare in the United States, I genuinely assumed that I would find at least one state in the union that had figured it out. Like maybe I'd uncover a fact buried on page 6 of Google that said, Vermont did that in the 90s, and we just forgot about it. I'm sad to say and frustrated to say that that didn't happen. What I found instead is that the United States is incredibly good at getting very close to universal health care, stopping just short of it, and then convincing ourselves that what we have is normal. And to be clear, what we have is expensive. About 100 million Americans are currently carrying medical debt. Roughly 1 in 3 adults say that they've delayed or skipped care because of cost. And studies show that medical issues are a contributing factor in around 60% of personal bankruptcies. Most of those people actually had insurance. So when we talk about healthcare in this country, we're not just talking about access. We're talking about whether getting sick financially wrecks your life. With that in mind, I started looking for where universal healthcare might already exist. And here's where things get awkward, if that's the word you want to use for our country. Of the roughly 38 industrialized nations in the OECD, I'll tell you what that is in a moment, all but one have universal or near universal health care coverage. So what is OECD? And I'm sorry, I know you don't need another acronym. OECD stands for Organization for Economic Cooperation and Development. It's an international group of high-income, industrialized democracies that compare themselves on economic performance, education, health outcomes, and quality of life. The OECD includes countries like the United Kingdom, Canada, Germany, France, Japan, Australia, South Korea, and most of Western Europe. These are the nations the United States usually considers its peers. And among those peers, there is exactly one country without universal health care. Can you guess what it is? That's us. We are the exception. We are the country without it. Every other high-income democracy figured out some version of you should be able to see a doctor without risking financial ruin. And they didn't all do it the same way. The United Kingdom created the National Health Service in 1948, right after World War II. They looked at the devastation of the war and said, cool, now let's make sure people don't die because they can't afford care. Healthcare became a public service. Canada rolled out universal coverage province by province between the 1950s and early 1970s. By 1971, every Canadian was covered, not in poutine, but in health insurance. Germany has had a form of universal health care since the 1880s, if you can believe it. Otto von Bismarck introduced a social insurance model where employers and employees contribute to sickness funds. That system still works today. France expanded universal coverage after World War II and caps out-of-pocket costs. Japan achieved universal coverage in 1961 with strict price controls. Australia reinstated Medicare permanently in 1984 after briefly losing it. Nordic countries built universal systems mid-century as part of broader social safety nets. Even countries that rely on private insurers like the Netherlands and Switzerland still guarantee universal coverage, regulate prices, and prohibit denial based on health status. So this is not a mystery. This is not theoretical. This is not untested. The United States didn't fail to invent universal health care. We just keep choosing not to adopt it. Now, before we keep going, we need to address something that's been in the public conversation lately. Luigi. Yes, people noticed that he was cute. Yes, the internet did what the internet does. But let's be very clear. Murder is murder. Violence is not justice. Killing a CEO or anyone is not the answer. Full stop. That said, the public reaction to that killing should not be ignored, because what people were responding to was not admiration for violence. It was rage at a system that feels completely indifferent to human suffering. The reaction wasn't violence is good. The reaction was people are dying while corporations are getting rich. And that distinction matters. In the United States, health insurance companies are not neutral administrators. They are for-profit corporations whose legal obligation is to maximize shareholder value. That means that their profits depend on one basic equation: collect premiums, limit payouts. One of the primary ways insurers increase profit is by denying care. Denials are not rare mistakes. They are a successful business strategy. Insurance companies use prior authorization requirements, narrow provider networks, claim denials, and endless appeals processes to delay or avoid paying for care. And while people are fighting those denials, they're still sick. They're still in pain. They're still rationing insulin. They're still skipping their treatment. Meanwhile, the 5 largest health insurance companies in the United States report tens of billions of dollars in annual profits. UnitedHealth Group alone, for example, reported over $20 billion in profit last year. Executive compensation regularly reaches tens of millions of dollars annually. So when people hear story after story of chemotherapy delayed, mental health care denied, surgeries postponed, or coverage revoked after diagnosis, and then see record-breaking profits on earning calls, something breaks emotionally. That doesn't justify violence, but it does explain the anger. What people are reacting to is the moral disconnect. A system where someone can die waiting for approval while another person gets rich denying it. This is not a personal failure. This is a policy choice. And it's a choice most other industrialized countries decided not to make. Naturally, I started looking at states. I looked at Massachusetts because Massachusetts feels like the kind of state that would have universal health care. And Massachusetts did do something big, just not universal coverage. In 2006, Massachusetts created a health insurance exchange paired with an individual mandate. That system became the model for the Affordable Care Act. Yes, Romney Care. Yes, irony. But that system didn't say everyone gets health care. It said everyone must buy insurance. Responsibility without simplicity. Vermont actually came the closest. In the early 2010s, Vermont passed legislation to create Green Mountain Care, a single-payer system. And then the math arrived. Honest math scares American politics. So the plan died in 2014. Other states have tried too. California, New York, Colorado, Washington, Minnesota. Lots of task forces, lots of studying committees and task forces, very little implementation. At the federal level, Hillary Clinton's 1990s reform effort was obliterated by the insurance industry opposition. Democrats learned a lesson that they still haven't unlearned. Then came the Affordable Care Act. Not universal, but transformational. More than 20 million people gained coverage. Thanks, Obama. Pre-existing condition protections saved lives, but access still depended on your job, income, state, and patience. Then repeal and replace destabilized everything without replacing anything. Now we live in a world where people technically have insurance, but can't afford to use it. That's not healthcare. That's a stress subscription with paperwork. Rural hospitals are closing. More than 130 have closed since 2010. And we haven't even talked about the one big ugly bill, which will cause Medicaid cuts and close additional rural hospitals. Medicaid cuts threaten emergency rooms, maternity wards, and mental health services. By 2030, every baby boomer will be over 65, increasing demand while policymakers propose spending less. That's not a hypothetical crisis. That's a slow motion one. And then there's Oregon. Lovely Oregon. Oregon is actively working toward universal health care. Is it complicated? Yes. Is it expensive? Yes. Is it messy? Yes. But at least someone is finally saying, maybe the richest country on earth should stop pretending that this is impossible. Healthcare should not depend on your job or your zip code. So today we're talking about why universal healthcare still hasn't happened, why the Affordable Care Act or Obamacare mattered but wasn't enough, who benefits from keeping the system broken, and what would it actually look like to finish the job. Because the real question isn't whether we can do this, it's why we keep choosing not to. My guest today is Colin Stackhouse, Communications Coordinator for Healthcare for All, Oregon. Hey, Colin, how are you?
Good. Yeah, thanks.
Thank you for doing this podcast.
My pleasure. Yeah, exciting to new horizons,
Yeah, absolutely. So you may have heard the question for today that we're asking is, why does universal healthcare still not exist in America? So from your perspective, what are the reasons for that?
Yeah, I think it is complicated, and I wish that it wasn't so tied into like national identity and also misinformation, but we have this sort of perpetuated lie or like the narrative of rugged individualism in our country, which I think played a role in the mid 1900s when this was in the conversation, right? Canada switched to universal healthcare starting in the 50s. And so that around that same time in the US, there was a lot of that conversation happening here. And I think that there was the fear that was pushed about socialism, and connecting this idea of universal healthcare to that kind of national identity that we were afraid of as a nation back in the day. Also, different powerful groups have pushed against universal healthcare historically, and some still currently. So, and I think perhaps probably the biggest problem is misinformation about what universal healthcare would be or what it would do or the benefits. So I think there's a lot of reasons, and probably the biggest one is misinformation right now.
Yeah, well, thank you for that. And let's get into it. We'll dig a little bit deeper.
Sure.
For those who are listening who haven't heard of Healthcare for All Oregon, can you tell us what it is and what you do and what you're working on?
Totally. Yeah. So we, Healthcare for All Oregon, or HCAO, is a nonprofit 501c3. We've been around for about 25 years, and we specifically are focused on universal healthcare reform in the state of Oregon. We think that this kind of big transition needs to happen at a state level. I've heard some other folks talk about how the states are like the experimental grounds for the rest of the country, or for like the federal government. And so just as like a lot of changes start at a state and then could be expanded to the whole country, we think it has to be in Oregon, right? And so we've been educating and advocating for this amongst Oregonians and also in our legislature for the last 25 years. And it is pedal to the metal for the next couple of years because Oregon is lined up to make this transition first, which is hard to believe, but we think it's true.
Yeah, that's great. So a lot of people either don't understand or conflate terms. I mean, it's overwhelming, right? Premium, deductible, Medicare, Medicaid. Can you kind of go into some of these terms that are sort of like the quintessential things to understand about healthcare?
Sure. Yeah. I think in your, when you wrote this question to me, you listed them out. So Medicare is coverage for people that are over 65. Generally, there's a few subcategories of other Americans that also qualify for Medicare. One example is certain folks with disabilities. Another, because of the timing of the way this bill happened, folks that have renal failure, so like total kidney failure, they're covered under Medicare, which, like I said, is generally for older people. And kicks in when you're around 65. So that's one kind of coverage. Medicaid is generally for people that are lower income. So, excuse me, in Oregon, I think Oregon was one of the few states that allowed for Medicaid expansion, which I believe was at the same time as the Affordable Care Act implementation. But so Oregon has pretty good Medicaid. That's like a thing that we're known for and has saved the lives of thousands of Oregonians and is critical to our care. But for us in Oregon, I think that it kicks in at around 200% of the federal poverty level. I should have looked that up before. But regardless, Medicaid is generally for low-income people. And other terms that people find confusing are the ACA or the Affordable Care Act, which a lot of people refer to as Obamacare. And that is this marketplace that exists for people that are not quite below that poverty threshold, but can't just outright afford, to buy expensive healthcare, or maybe their company can't offer the best kind of, coverage or benefits. So on the marketplace, people can shop around and find the right kind of plan that works with their budget. So that's like a different thing. And then there's outside of the marketplace, there's regular health insurance. I think part of the problem is that there's so many subcategories for all these things. So even with Medicare, like I said, is generally for people over 65. There's now managed Medicare plans, or some companies refer to them as Medicare Advantage plans, and that's another nuance. So was that all of the terminology?
No, that was great. What about, I have a couple more to throw at you. So what about the premium and deductible words?
Yeah. So premium is your monthly payment. Your deductible is your over the scope of your year. That's how much you need to pay in addition to your premium to attain your full level of coverage. So a lot of people, the phrase meet your deductible, like I have some friends who have met their deductible earlier in the year. And so in November and December, they're just getting as much care as they can before it resets in January and your deductible goes back down to zero. And so then to get your full coverage again, you have to start paying both your premium, which is your consistent payments, your co-pays, which could be an additional one-time fee per every visit or every encounter with a provider. And then there's also your deductible, which is in addition to those two payments, it's your out-of-pocket maximum is another phrasing for that deductible.
When you said meet your premium, I thought of it as like a meet cute situation.
Oh, is that what I said? I didn't mean to say that.
No. In my head, I was thinking meet your deductible. That's what I meant.
Or can you imagine like a speed dating thing where you're like shopping around for different insurance plans, but all of them are not what you want.
And then another one that I think is really important to talk about is single payer versus Medicare for all, and then universal health care. I think all of those terms are kind of conflated. Can you talk a little bit about that, and then what the Healthcare for All Oregon plan would be in relation to those words?
Sure. Yeah. So we are advocating for universal, publicly funded, single payer healthcare in the state of Oregon. That's what we think is the best choice for our state and also the rest of the country. As far as those three different words, single payer, Medicare for all, and universal healthcare. Universal healthcare is I would say more of the umbrella term for what we want to achieve, which is that everybody can access care and nobody's becoming destitute because they got sick, right? So there's lots of countries that have universal healthcare, like most wealthy countries besides us have some sort of universal healthcare system. And one of my colleagues described it in a really great way, which was that for every country that has a universal healthcare plan, there's a different way that they got there. There's a different approach to it. So that's one thing to consider. Universal healthcare is just the concept that everybody should be covered. Medicare for all is something that we, as an organization, we ultimately are interested in that idea, but that is not specifically what we're focused on. One of the reasons, personally, not speaking for our whole organization, but the idea of Medicare for all right now, there's a big push for these Medicare Advantage plans, which from our perspective are actually a big disadvantage to many of the people who decide to sign up for them. They're very limited. So in its current framework, I and our org doesn't really want our current version of Medicare to go towards every person in the country, because it would be still too convoluted and too confusing. To add a little more confusion to it, in Canada, they refer to their system as Medicare, so they have a single payer universal healthcare system, which they also call Medicare. And so just FYI for folks that are trying to learn about different systems around the world, single payer is the idea that there is basically one insurance company. I'm using air quotes in that, but one payer, one entity. You can think of it as one insurance company for all, but that's not quite accurate. It's the entity, the organization, the public corporation, we hope in the case of Oregon, that is going to cover all the costs. And so for most countries, that's the most efficient. So in England, for example, they have their national health insurance, and that is one single payer entity, which just means that they're the only organization that is ultimately responsible for the bill.
And is that a private company? Is that a government department?
Yeah, in most cases, it's a government department. So in England, and Taiwan is another great example that we can talk about further, but they have a government entity that foots the bill. I'm actually not aware of any organization, any country or other state that would have a private company covering the costs. I think that's not in the best interests of the patient, right? Because they would still have this focus on revenue.
So these other countries that have done this, it seems like they've done it in all different ways. Mm-hmm. Is there a way that makes sense for Oregon or federally? We should be, a little bit of Canada and a little bit of Taiwan, and that's our healthcare plan. What sort of model are we looking at as a sort of North Star?
That's a great question. Yeah, I think something that's really special for Oregon is that we have the ability to look at other countries that are making this, that have made this move already, and we can sort of pick and choose what has worked best around the world. In Taiwan, we talk about Taiwan a lot because their healthcare system has been ranked #1 in the world for a couple years in a row. They have about a 92% satisfaction rate, which sounds pretty great. And they only spend, I think, 7% of their GDP on healthcare. You compare that to the United States, our satisfaction rate is much lower, and we spend about 16% of our GDP on our healthcare, right? So they're spending half the money, but a lot more satisfaction. The thing that I think is cool about their system is that they have that single payer National Health Insurance Administration agency. That's a government agency that covers the bill. But basically, all of the care is done by private corporations. So I don't know if they have the same for-profit versus nonprofit model. And I know that there is some government sponsored clinics or services, but basically everything is done privately. So people can choose, the Taiwanese people can choose which hospital is actually serving them the best based on their own preferences, and not, pigeonholed by whatever their payment system is.
So simply put, would it be that Taiwanese folks are paying taxes? The taxes go to this government agency. The government agency then pays for medical or hospital bills.
Yes.
Okay.
Yeah.
and in full, I would imagine if there's a 92% satisfaction rate.
Yeah. I mean, I think that they're, now we're getting into the details of how Taiwan's actual implementation works. I do think they do have some copays, which we advocate for no copays or deductibles, or that kind of meeting your out-of-pocket maximum. I know that they do have, I believe, some copays, but I don't know exactly what it is. But the entity is, you've already paid for it in the form of your taxes. You've been taxed, and at the other end, once you receive your care, you don't have any more bills to worry about, basically.
Well, right now my taxes are going to billionaires getting tax breaks.
Oh, what do you mean?
So at the core of this, this is potentially a moral issue and a human right. Can you kind of speak to that of there's healthcare as a business and as a bureaucracy, and then there's what we should be doing for people?
Yeah. I mean, the moral argument is kind of, I think, so blurry, or any moral argument in our country and our world right now is different people have different opinions, but I think that it's pretty clear when you do a dive into what's happening with our healthcare system. It saves money and people are healthier under these universal healthcare systems. And I think that we deserve to be healthier and save money. Like, yeah, I think that when I look around where I live in Portland and I drive on the streets, there's a lot of overlap. There's an overlapping Venn diagram of problems, but one way to articulate what I see with people who are unhoused and living on the streets of Portland is that there's all these sick people that are just left to fend for themselves. And I know that they are covered generally under the Oregon Health Plan, but they're still very sick and surround all these areas of my city. And I don't feel morally great about it. I feel like we have failed them, and it's just so clear. And there's so many, I worry about people losing their jobs and the effects that that'll have on their healthcare. Like the amount of stress that we have sort of, I feel, permeating most of our society just in related to healthcare, that kind of moral injury that doctors and other providers have to navigate when they're working within a system that is dysfunctional. Other countries don't have this issue. Other countries have put this idea to rest decades ago, and they're much healthier and thriving in a way that we deserve to be.
And I think one of the things you're alluding to with doctors is that it's not always about what the patient needs or the Hippocratic Oath. It's, hey, I got off the phone with your insurance company. Even though you need 3 surgeries, your insurance company will cover 2.
Right.
So we're putting the doctor as a broker for your health.
Right. Or a patient must rely on being their own advocate, or hoping that they can cross their fingers to get a doctor who will make that 7th phone call. Maybe a different provider will stop at 6 to work on your pre-approvals isn't quite the right word, but anyway, instead of just assuming that the system will take care of you, patients have to be their own advocates, or just cross their fingers that they have a doctor that can work for them. Or a lot of, wealthier people are shifting to sort of concierge service for their physicians, right? So there's an on-call doctor who can operate to a degree removed from the convoluted, broken system.
Yeah, you mentioned something earlier that I think is really important, which is that healthcare in America is often tied to employment, which is a really big problem. I mean, one, we live in a contractor freelance economy or small business owner economy. And the other is we are having people stay at a horrible job so that they can keep insurance benefits. So right. Can you talk more about that? Like how employment and healthcare sort of coincide and potentially shouldn't?
Yeah. So I don't know, all of the history about it, but I've heard it described that we sort of fell into this current employer provided healthcare scenario. I think after World War II, there were incentives for employers to cover the costs of their employees during that time. And I think one thing led to another. I think it was maybe in the sort of Reconstruction timeframe after World War II, but it just sort of became standard to have it be like that. One of the laws that came into effect in the 70s, so, World War II in the 50s is when we sort of shored up this employer provided insurance as standard. In the 70s, there was this push to regulate the employer provided insurance in a way that stopped states from toying with it or limiting it. So one of the laws that our work in Oregon is going to have to deal with is called ERISA, which is ERISA, which is the, I believe, Employee Retirement Insurance Services Act of 1979. basically it says that states or other entities cannot like toy with employer provided insurance, right? So if an employer is able to offer insurance to their employees, it's not a relationship that can be affected by the work of the state. I think that's correct. It's complicated. I hope that was a good answer.
Yeah, no. And so, some people are in between jobs, some people are unemployed, some people are contractors. So it doesn't make sense to have the sort of economics not match the healthcare system, which is, on the list of reasons why we should do this, but that is one of many. If you don't mind me asking, I know you grew up somewhat religious.
Yeah.
And, we see memes sometimes, or I often think of this, Jesus would not say, hey, you spent too much money, you're no longer covered, or you have a pre-existing condition, or you haven't met your deductible. So, but we do have a lot of people who sort of they tell us that they're both patriotic and religious, but then they're against universal health care. Can you just comment about that or talk a little bit about how being religious or spiritual, not necessarily you, but people that how that potentially relates to debates such as this?
Sure. Yeah, totally. I did grow up religious. I grew up Catholic and don't really practice that now, but I'm glad to have that as part of my past and my present and my future. I think going back maybe like a question or two, or the topic of like moral righteousness or like a moral factor in this, I think as soon as I sort of learned about this being so broken and how an easy solution or an easy way to think about it is often like the simplest, right? Which is that if we had this, if everybody agreed with me that this moral imperative mattered, we would move forward to make these changes, right? So, and I sort of, for better or for worse, kind of fall back on that thinking as far as like why some of the details like don't matter as much, right? Like I don't really care to learn the history of why after World War II, we landed exactly where we are and all the nuances of that one bill that I mentioned. So, and so in that same way, I think that like a religious or a spiritual eye to this issue comes to really easy solutions, right? And I'm not a practicing Christian right now, but like Jesus fed the hungry, clothed the naked, healed the sick, right? And so what would Jesus do? He would heal the sick. Easy to answer that question. He wouldn't make a million excuses why it's actually not good for the sick to be healed, or make a million excuses why this wealthy member of society doesn't have to play a role in healing the sick, right? Healing the sick is part of his work. So my hope, our organization does have a faith caucus. So we've been building relationships with faith leaders around the state for 20 years. We had a conversation with a faith group recently that went really well, and I'm excited for more of those, connections and relationships. So to answer your question, or I feel like I'm like crashing out a little bit. Can you say that question again, and we can like?
No, you did great.
I want to get into a nice ending, but yeah.
Yeah. So, what would Jesus do? Would Jesus support universal health care?
Yes. Jesus, let me just like do a little quick Jesus check. Absolutely. Jesus would support universal health care. It's simpler. Keep it simple, stupid. Shall we heal the people who are sick, or shall we make excuses to find a reason why we can't possibly heal them because it'll hurt a rich person's bank account? I think Jesus would have a pretty quick answer as to what the right decision is.
Yeah. And you were talking earlier about Obamacare or the Affordable Care Act. And, that did amazing things, does amazing things, but it's still a marketplace and you still have to pay for it and it's getting more expensive. The Republican Party voted to get rid of it. I can't even count how many times. It's got to be 70 plus times. Why do you think politically that there are people who are against this when cancer, for example, knows no party?
Yeah, that's a good question. I think that maybe if a different Democratic president that wasn't Obama had proposed the Affordable Care Act and there wasn't the connection of his name to it or the label that some people have put of Obamacare on this effort, I think maybe they wouldn't care as much. But I do think that there is a through line between sort of a consistent aversion to that name, Obama, from Republican people. I don't really have a good, their explanations like fall short to me, and especially with the religiosity component of a lot of what Republicans, stand for. Like as I said, sort of once you have like a moral decision on your own part, and like I said, I think that getting universal healthcare is a more moral decision. I don't really understand the dancing around on both parties, frankly, about why we haven't moved to get here. So, I think it's tragic that this work, Obamacare, the Affordable Care Act, is it besmirched by being connected to that person's name. And I hope that we can move forward. I don't think the Affordable Care Act did nearly enough, right? So saying that it's like great and helpful is like, sure, it's better than a stick in the eye, but it's not like fine.
No, that's a good point. Some of the people who you work with, staff, board, volunteers, they've been working on this for 20, 30 years. Have they ever told you why they continue? I mean, I'm sure that there's got to be daily frustration of either people ignoring this, people saying, why bother? That's not going to happen.
Yeah, I think that why do we stick with it? So I was introduced to this idea of Oregon's path to universal healthcare in 2021, in early 2021, a longtime volunteer, former president of our nonprofit, Tom Sinsick, sat down with me and sort of outlined the path. Even then, 5 years ago, he was like, actually, if you connect all of these dots, Oregon can be, the pathway exists and it's like it's very brushy and you can like barely see the shining light at the end of it. But I think the reason that I'm able to stay with it is that I can understand the steps that Oregon needs to take to get there. And a phrase that we've been landing on is like audacious and tangible, because it is pretty audacious to say like, oh, Oregon's likely to be first. But when you think of it, one state has to go first. And I think that we're just in a good position to recognize that we somehow have this opportunity. Be very excited if another state goes first. Sounds great, but I just don't think it's going to happen. And tangible, like it is tangible. And so it's sort of really for our volunteers that get connected and get fired up, like it inspires hope. And you're like, cool, we finally have actually something where we can affect change today, tomorrow, the next couple of years, and move this to happen for our state, for the people that I care about. We're tired of being sick.
Yeah, absolutely. So if people want to get involved in what you're doing, we live in a time where all people matter in terms of involvement. So whether you're on the ground marching or sharing or doing legislative work, or like, can you give us kind of a viewpoint of all the ways to help and people who are listening and how they can get involved with this movement?
Totally. Yeah. So our organization, we're sort of building our coalition over the next couple of years. So our website is hcao.org, healthcareforalloregon.org. The big red button is the signing our statement of support. So basically gets in our database, lets us know that you want universal healthcare for the state of Oregon. It signs you up for our email newsletter, right? So you'll be connected. We'll also use that database to reach out for more actions as we get closer to this vote. So that's one way. Donating, any nonprofit will tell you that they need donations. This last year of being a contractor with HCAO is my first rodeo into nonprofit land. And it's exactly what everyone said, where everybody needs money all the time. So donating honestly helps us with our communications and our production of materials and supporting our chapters. Chapters is our geographic way that we describe, people around the state. So there's a Portland chapter, Lane County, Southern Oregon, in La Grande, there's a chapter. So we've got organizations, groups of volunteers all around the state that are coordinating different events. So whether it's a fundraising event or a community conversation where we go out and talk to people about this very confusing topic. So another way to get involved is invite us to come speak to your organization. People can show up to an HCAO 101 class, which we offer about twice a week, where volunteers sort of walk you through a little bit of what I'm talking about, like who the heck is the nonprofit, what's happening with the state of Oregon, the nuances of the governance board, which I hope we get into that in a minute. But yeah.
And if you had a magic wand or gold lever, where would these efforts be in a year or two from now?
Yeah, so a year from now will be in December 2026. So a year from now, the Universal Health Plan Governance Board will have delivered their transition plan to universal health care. That's due in September 2026, and September 15th, 2026 is when they're obligated to deliver it. So a year from now, we'll be gearing up for the 2027 Oregon legislative session, which is a long session, I think. Yes, it is a long session. A year from now, we will be encouraging people in Oregon to reach out to our legislators to encourage them to either implement this transition that they requested, because a year from now, our Oregon state legislature will have the power to implement a universal healthcare transition. That is a reality. They will have the power to just do it. We think that politically, they just won't want to do it. There's a couple options, and there's a couple options in December 2026. Either they will be preparing to implement it in January or February. They can push some bills forward and just start our state's transition away from a broken healthcare system to something that actually works. They could refer it to us through a couple bills in that session to vote likely in November 2028. So a year from now, we'll be encouraging Oregonians to let them know that we care about this and we want our state officials to do that. The third option, if the legislature does nothing, they don't get it on the ballot and they choose to make no action on their own, then it's up to Oregonians in 2027 to start gathering signatures to get this on our ballot eventually in 2028. And
we all moved to Canada together.
I mean, I'm good. Canada's cool, but I want to be here. So
I appreciate your work. Thank you for doing this work.
Yeah.
And hopefully people realize that healthcare is a moral imperative and something that says that you care about fellow humans.
Yeah. Yeah, you bet. I'm glad to talk about this. May I speak a little more about like the path?
Yes.
Yes. Okay, great. So it is, well, I'll give two parts to this. One is, why do I think that Oregon is the best state for this, and the path that exists for us right now in December 2025. So we're the most likely state because I don't know if you've heard, our healthcare system's totally broken and people are ready for a change. That's like the main factor of it. We're better set up than most states in that we have a constitutional amendment which guarantees healthcare as a fundamental right of every person in the state. That we're the only state that has that phrase fundamental right in our state constitution. That was Measure 111, which passed in 2022. Healthcare for All Oregon helped advocate and educate about that ballot measure, and we did pass. We also are the only state that has a universal health plan governance board, which is working right now, that is obligated to deliver a transition plan in September 2026, right? So there's other states that have different committees. I think Washington has had a committee working on it. But as far as Oregon, like, we're the only state that has this board that must deliver a functional transition plan. I think similar to Vermont's effort to move to universal healthcare in 2011, but we're learning from their failure, because Vermont did not move to single payer universal healthcare, building upon it, and other failed state efforts. So we have those things going for us. We're the only state with that constitutional amendment, and we also have this board that must deliver the plan. As far as the timeline, the pressure cooker of the governance board and their sort of immense, incredibly complicated body of work is right now. Between now and September 2026, they are building a plan for how we finance the universal healthcare system. So what are the taxes going to look like? Is there going to be an employer, kickback after they contribute a certain amount, or are we going to try to shoot for 7% or 9% or whatever? They're like building a framework that has to work, right? They're talking with providers about what's going to be covered. They're doing stakeholder listening sessions with insurance companies. Unfortunately, they have to be spoken to. I mean, that's maybe rude to say, but I mean, insurance companies cause a lot of harm. I think it's, from my perspective,
it's not rude to say.
It's not. I don't know what's rude anymore, honestly. So anyway, so the governance board has to talk to these different stakeholder sessions, and it's between now and September 2026 is when Oregonians can tell them what they need in a new universal healthcare system. So I didn't list this as the way that people can get involved because we're a different organization than the state's governance board. That their website is oregon.gov/UHPGB, Universal Health Plan Governance Board. But another amazing, incredible thing that we need Oregonians, and frankly, anyone who's interested in universal healthcare to do, is to share their public comments with the governance board about what they want in a new universal healthcare system. So you can submit your public comments. They have 9 more monthly meetings before that September deadline. There's other smaller committee meetings, but and then, like I said, once they submit their plan in September 2026, then there's going to be work in the legislature in 2027, but Oregon can expect to vote on this in November 2028, maybe a different month. I've heard that they can do elections in January, May, and November. Likely November 2028 is when we can see this on our ballot.
Cool. Thank you so much for explaining all that, doing this work.
You're welcome. It's like a word, like info dump. Do you have any more questions or what?
No.
Okay.
You've been great. Thank you.
Yeah.
Well, it looks like we've reached the end of this episode of All American Why. If you made it this far, congratulations. You're officially an excessive thinker too. If something today made you laugh, cringe, or reconsider everything you thought you understood about this country, good. Well, that's the point. Subscribe, rate, review, and share All American Why wherever you get your podcasts, including on YouTube. Or don't. It's still a free country. For now. You can find me, Michael Jonas, on social media or at allamericanwhy.com, where we're building a community for people who still give a damn. All American Why is recorded at Sasquatch Media Grounds in Vancouver, Washington. Original music by Renezra and Views. Audio editing by Kyle Gilmore of Residual Audio. Until next time, keep your curiosity loud, your optimism spiteful, and your democracy under constant surveillance. This is All American Why. Thanks for listening.
All American why? All American why? All American why? Ask yourself the American why.